Good morning, good afternoon, good evening, good whatever time of day it is. Thank you for tuning in to Conversations with Dr. Don. For your first-time viewers, Conversations with Dr. Don is an ongoing series of 1 hour standalone talk shows where I interview interesting people like most of you out there about who they are as unique, one-of-a-kind individuals and about whatever it is that we have decided to talk about. And my guests tonight are repeat guests. They've been on before, and I have to have them on again because they're always so full of good stuff to talk about. They're delightful to have. And to my immediate right here is Steve Weiss, who's been on, I've lost count how many times you've been on through the years.
7 or 8 at least.
7 or 8. And Dr. Sam Metz, who's been on a number of times too.
I'm a mere novice compared to Steve.
Title of tonight's show is Single Payer Healthcare, What It Is and Why You Should Care. So we were talking about this primarily from an Oregonian's standpoint, but what they'll be talking about has applicability around the country in other municipalities and other states, and of course on the national scene, healthcare and related subjects. So as you know, it's been such a while, we're going to do the first half of the show, or less than half, on who you are personally, so the audience has an idea who you are and where you're coming from. And then we'll go into a list of things that are relative to single-payer healthcare, and we'll talk about those in turn. And I'm a little nervous because I didn't give you proper instructions when you were coming to the studio. I forgot that you didn't know that we'd moved. And you were very patient with me, Sam. I appreciate it. Can I call you Sam?
You can call me Sam, yes.
What should I call Steve?
Well, you can call me Steve.
Your Highness.
Yeah. I've known him for a long time. A fellow Democratic Socialist, yeah. Pardon me, you right-wingers who are watching, forgive us.
No, don't ask forgiveness from them. We're proud to be socialists.
You bet.
Some of my best friends are socialists.
Oh boy, here we go. Gonna be a good night tonight. So let's get started. And Steve, talk about who you are, because you know the routine, and if there's anything you missed and you're discussing who you are personally, I may ask you a question or two about it. Is that okay?
Oh, absolutely.
And your full name is?
Stephen Neil Weiss.
Neil?
Yes.
Where did that name come from?
I don't know, but the Stephen came from Rabbi Stephen Weiss, who was an advisor to Presidents Roosevelt and Truman, and who for 6 years, from 1898 to 1904, had a congregation right here in Portland, Oregon.
No kidding.
No kidding. So my mother named him after him. And I've always liked my first name, and I'm grateful for her for doing that. And Rabbi Weiss, in 1932, supported Norman Thomas for president.
Boy, your liberal leftist credentials are long, huh?
My mother didn't know that. She might not have named me after him if she did. I don't know.
So say some more about who you are personally, if you will.
Well, I'm an advocate and activist. I have many affiliations in the community. I'll rattle off a few of them and trot out my ribbons.
We've only got 2 hours, Steve.
Okay. So currently, I'm board president of the Oregon State Council for Retired Citizens. We're the only senior group in the state that endorses political candidates. We have our own political action committee, and I'm president of that too. I'm board president of Independent Living Resources. We're the largest center for independent living for people with disabilities in Oregon. And I'm board president of the Community Alliance of Tenants. CAT is the tenants' rights organization in Oregon.
A little slower.
Okay.
I'm rushing you, and I'm causing this.
Okay. I'm also chair of the Multnomah Elders in Action Commission. I'm chair of the Department of County Human Services Citizen Budget Advisory Committee. I am chair of Health Share of Oregon's Community Advisory Council, and by virtue of that, I have a seat on the Health Share of Oregon Board of Directors. Health Share of Oregon is the largest coordinated care organization in Oregon. It has 162,000 members.
At some point, you should explain what coordinated care organizations
We'll get into that one later.
Nice, Sam.
I also serve on the board of United Seniors of Oregon. I serve on the board of the Oregon Consumer League. I have numerous other affiliations. Essentially, I regard what I do as social justice work, but to a large extent, it's within the area of advocating for seniors and people with disabilities and for the preservation of the social safety net, which is one of the things I want to talk about this evening.
The social safety net.
Yes.
Are you some kind of a communist?
No, just a socialist.
Okay. Well, yes. You have any people from the past
His mic is not working. We don't know why.
or alive today that you particularly admired or look up to? Any names of those people come to mind right now as we speak? Of course, I have my list of people that I admire, but I've been doing this for so long until I memorized all of mine, and I've narrowed it down to just 4. And how many people do you remember that you look up to or admire besides Norman Thomas?
Well, I'm a great admirer of Noam Chomsky.
Chomsky?
Yes, Professor Chomsky is now 83 years old, and he's still as sharp as ever. I still look forward to anything he writes because almost everything he writes expands my mind and my consciousness in regard to almost anything that has to do with politics or social sciences or almost any other area. He had a column recently that was more personal than most. I didn't know it, but Professor Chomsky's wife died a couple of years ago. They've been married for a very long time. She was an academic in her own right. And I could tell he was still feeling the loss of that. One of the things he's doing is simply working at a frantic pace, giving speeches, appearing places. At the age of 83, that's fairly remarkable, but I wish him a long life. We need him. He's one of the very few public intellectuals that is not replaceable.
You know, so much of the stuff that you say provokes questions from me, but I've got to stop because you and I will go on forever and ever, all right? Let's go over to talk to Sam. Tell me who you are personally so the viewers will have an idea who you are and where you're coming from.
I'm a physician. I'm an anesthesiologist. I've lived in Portland for about 6 years. I have a wife and daughter. Because I'm an anesthesiologist, I'm not quite one of the 1%, but I'm one of the 3%, which puts me in an interesting perspective when it comes to talk about single-payer health care. I've been working on health care reform for about 3 years, having no interest before that. I got into an argument in one of our physicians' lounges about what was wrong with American health care, and I knew what was wrong. It was end-of-life care. And everybody else said, no, it's not end-of-life care. It's fee-for-service. No, it's immigrants. No, it's patient demand for unwarranted care. No, it's high technology. The first thing I figured out was nobody else in the room knew what they were talking about. But the most important thing I discovered was I didn't know what I was talking about either. So for the last 3 years, I've been trying to figure out what I was talking about. And the more I learn, the less I know. Healthcare is an intimidatingly complex arena that just scares the living daylights out of most of us because it's also vital. If we don't figure out a solution to this very complex pattern, people will die, maybe people we know. That's why I'm in this.
It seems that some other countries have figured out a little better than the U.S. has how to take care of their citizenry.
The only countries that have figured out a better way to take care of, to provide better care to more people for less money is every other industrialized country on the planet. No matter where you go in the industrialized world, if you look at their system, they take care of a greater percentage of their population, they spend less money, and their population is healthier. We are head and shoulders below every other industrialized country. We have very little in healthcare that we can take pride in.
The question is why, but I neglected to ask Steve a question. You have to go back to him because you confessed, I mean, you've proudly talked about your marriage and your children. And I wonder, Steve, are you married since I talked to you last, or are you available?
I am available.
He's available, girls! Get Steve.
But in all honesty, I have to tell anybody out there that in 2 weeks I will be 70 years old.
70?
Yes.
Oh, you don't look 70.
Thank you.
You look 90. No. No, you look great, buddy. Yeah, it's always fun to be with you again.
I can't believe I'm the junior member here. I was feeling pretty old until I got here. And now I'm feeling like I should be skipping rope and kicking my heels in the air. But the two of you look more vigorous than I am. Now I'm really depressed.
Yeah, just a few days ago, I turned 84.
Wow, you do not look 84.
And the only reason I say that is because by the response usually is, you do not look 84.
Well, I hope I make it to 84, and when I do, I look as young as you are.
So, I can't think of any more. Oh, how about any heroes or people you look up to or admired through the years or alive today?
Alive today, there aren't many of them.
Uh-huh.
There are a few leaders in our country who have put integrity above ideology, but there aren't many of them.
Name me one or two.
No, we have a common hero in John Conyers, the Michigan representative, who has written and submitted House Resolution 676, America's national single-payer plan, for 10 years. And he is still out there. He's in his 80s.
Mm-hmm.
He was out here 2 years ago to speak to a conference here in Portland on single-payer health care. Flew coach, stayed on someone's couch so that he could make his point. This is a man who lives his ideals.
Uh-huh. We've lost Kucinich, Dennis Kucinich.
Yes.
How do you feel about that?
I give Dennis Kucinich credit for his ideology. He didn't translate it into effective political action.
Mm-hmm.
That counts for a lot. It's one thing to advocate for a cause. It's another thing to make things happen. That's what sort of separates the women from the girls, as it were. You've got to be able to translate what's right into real action.
And you need to have a minimum of support from colleagues, too. But if you're standing all alone, then what do you expect from him, for God's sakes? How about Bernie Sanders?
There's a man who has made a name for himself, who has achieved a few things for which he gets credit.
Sure.
And he certainly comes from a state that is willing to experiment and do new things, and a state that's going to take the lead in healthcare in the United States. That's Vermont.
Elizabeth Warren.
Let's see what she does. She certainly has her heart in the right place. She certainly believes that people who can't take care of themselves deserve our attention and care. As you just pointed out, she's in a hostile environment. Now, I do have to give credit to Hillary Clinton when she was a senator, because she managed to achieve a few interesting projects, and she could work. She had a project in which she worked with Newt Gingrich. Can you imagine that?
Oh, my God. Rick, do you hear that? Rick is my
they say that
conservative crew member who harasses me all the time for having these love fests between progressives.
politics is the necessity of strange bedfellows. And she was willing to work with someone I despise, and probably someone that she despises, but that's what you have to do to get things done in this country.
I'd like to say something about that, but I can't think of it. What do you got to say about that?
No, I don't know that I have anything to say about it right now.
Mm-hmm.
We'll get into some political matters, I think, down the line here today.
All right. Well, anything more personal we should talk about now, or should we shift over into the next mode where we're talking about the things we really want to talk about to do with single-payer health care, what it is and why you should care? Well, shall we start with what is single-payer health care?
Single-payer health care is a method of financing health care. It says everybody in the population is included in this plan with no discrimination against the sick. It says if you need health care, you go seek it. There's no penalty for seeking health care. And the third key ingredient of single payer is the financing is done by publicly accountable, transparent, not-for-profit agencies. Now, there are various systems out there that have multiple not-for-profit, publicly accountable, transparent agencies and apply the other two principles. But if you have just one, we call it single payer. There are entire countries that have single payer systems. Taiwan, for example. There are single payer systems within the United States. The Veterans Administration healthcare system is a single payer system. And there are multiple private single payer systems in the United States. Single payer as a healthcare plan was created in the U.S. by an American capitalist named Henry J. Kaiser. And he was building dams out in the middle of the California wilds, and he came up with 3 ideas for his business. The first was, if he kept his employees healthy, they'd be more productive and he'd make more money. The second idea was, if he paid providers directly without using private health insurance, he'd save a lot of money. And finally, he figured out if he kept his employees and their families healthy, he could attract and keep productive employees. And you know what? He was right. And it spread to every large corporation in the U.S. Almost every corporation in the United States uses its own private single-payer plan. They call it self-funded. But essentially, the employees and the employers contribute to a fund which is administrated by people who are accountable to the employers and the employees, and they pay providers directly, with no discrimination against sick employees. It's so effective that it's essential if you're going to succeed as a large corporation in the U.S. There are about 27 million Americans who get their care through private single-payer agencies. It's not some alien socialist commie plot from across the ocean. It's born and bred here. It was perfected here. And it's the only model in the U.S. that provides all of its participants with better care for less money. It's the model we should all use, not just the big corporations.
Well, then, what percentage of the working community has the kind of coverage that you're talking about now?
Certainly not enough, because in order to make a self-funded plan work, or any healthcare plan work, you need to have a lot of people, and you need to make sure that you mix the healthy and the sick together. So you need a couple thousand people at least. 10,000 would be better. 100,000 would be great. And in Oregon, 3.8 million would be a great size for a single-payer plan. We all participate.
So single payer in this instance for a big corporation would be the corporation.
It would be the single-payer fund that the corporation and employees contribute to.
And who manages this fund? An insurance company?
No, it's managed by a board of employees and employers who are responsible for providing the best possible care to every member for the least amount of money.
How can they function without an insurance company managing things for them? Don't laugh, I'm trying to be serious.
You bring up a good point. The American private insurance industry has a very odd business model when it comes to health care. It puts the insurance company business interests completely antithetical to clients' medical interests.
Yes.
Now, other countries use private health insurance companies as well, but they play by different rules.
How's that?
Well, if you're a private health insurance company in France or Germany or the Netherlands or Switzerland, first, you can pick whatever price you want to sell your policy at, but you have to sell at the same price to everybody, whether they're sick or healthy. Second, you have to sell your policy to anybody who asks. Third, every policy you sell has to cover every treatable disease. So no patient, no matter how unsophisticated, illiterate, or intoxicated they are, will walk into an insurance office and say, I want that one because it's green and it's my favorite color. They can pick any plan, and they know that neither they nor their family will go broke or die if they get a treatable disease. Next, they have to pay every claim, every provider. They can protest it as inappropriate, but only after they've paid. And finally, if the government discovers that somehow or other you as an insurance company have managed to cherry pick the healthiest patients, you pay a premium that subsidizes the poor insurance competitors who have the sick patients. Now, in a system like that, you're an insurance company. How can you compete? You compete with lower prices, extra benefits, better customer service. You don't see a lot of that here in the United States.
Doesn't competition take care of that?
In the United States, the business model says to successfully compete as an insurance company, you have to avoid sick patients. And the best way to avoid sick patients is to charge more money. Private insurance companies in Oregon last year shed about 25,000 people. That is, they're insuring 25,000 people less, and their net revenue has increased by 25%. They're making more money by insuring fewer people, making sure that they're healthy. The second rule is as soon as somebody gets sick, you want to get rid of them as quickly as possible. And considering that the average American changes their insurance company every 6 years, there's plenty of opportunities to do that. You want to make sure that you pass as many costs on to patients as you possibly can, so you sell high deductible, high copay plans. And finally, when it comes time to pay providers, you delay or deny payment. The average insurance company denies 30% of all first claims. Not because they're bad people, because that's the business model. The longer you hold on to your money, the more you make.
You said a magic phrase there 2 or 3 times, the business model. It seems to me the priority of taking care of citizens is out of order. The business model, profit is first, and caring for patients is secondary, if not even tertiary. Making money is of prime importance, and we're just instruments. The citizenry is just instruments toward that end rather than the other way around. You ever going to say something? I could feel it.
Only the first words of the Hippocratic Oath came to me. First, do no harm. The Hippocratic Oath, of course, refers to the oath of the medical profession, but it has a larger truth, I think, in regard to how our medical system is put together in this country. Our existing medical system does great harm to a great many people. It does so because profit basically corrupts the system. We don't think people should profit off of medical care, and that a public medical health system should be nonprofit because of that. Every other industrialized country in the world has something like it except us. But the United States of America not only is a different country, sometimes I feel like it's a different planet.
I'd like to take something that Steve said.
Mm-hmm.
We have to distinguish between the delivery of health care and the financing of health care. The financing of health care is a brokerage. You take money from patients, you give it to providers. In the United States, that's done primarily by for-profit agencies. We're the only country in the world which depends upon people making a profit to finance healthcare. Now, the delivery is different. That determines which providers get paid how much, under what conditions, to what patients, under what circumstances. In most countries in the world, you can make a profit delivering healthcare. There are for-profit physicians, for-profit hospitals all around the world. We're the only country that needs to make a profit financing healthcare, and we pay a huge penalty for that. Now, it's not just the profit, because in Oregon, most of our large insurance companies, health insurance companies, are not for profit, but they have to follow the same rules. It doesn't matter whether you're for profit or not. No insurance company can make money selling comprehensive health care at affordable prices to people who are going to get sick. And you mentioned something key, whether you're for profit or not. Any insurance executive who puts the medical interests of patients above the financial interests of the company, at the very least, will be fired, and at the very worst, will be arrested and charged with violating their legal fiduciary responsibility to put the finances of the company first. That's the business model. And the business model does not permit any insurance company to sell money-losing policies, like selling affordable, comprehensive policies to people who are going to get sick. There's no way to make that work.
As we go on into the show, we will figure out what the solution is or the answer to the existing system in this country that is not caring for the citizenry the way it should. So I think we better take a break before someone yells at me in the control room. Shall we take a break in there, please, for a little while? Okay, we're back, and we're having a good time talking before you guys put the cameras on us again. And I got to say something to you viewers who turned in late or who are channel surfing and just stumbled across this program. The show you're watching, Conversations with Dr. Don, is an ongoing series of one-hour standalone talk shows where I interview interesting people like most of you out there, and like my two delightful guests here tonight who've been on before, about who they are as unique, one-of-a-kind individuals, and about what it is that we're talking about tonight. Tonight we're talking about single-payer health care, what it is and why you should care. And so far we've been talking about what it is in some sense. Now we'll go into more detail about that. So shall we resume? Where shall we start?
Well, Representative Michael Dembro introduced a single-payer bill in the state legislature in 2011.
Is he a state representative?
He is.
He's a state representative.
State representative.
Okay, Michael Dembro.
So this would be for the state of Oregon.
Mm-hmm. Thank you.
That bill didn't do very well in the 2011 legislature. I don't know that it got a hearing, did it?
It got a very lively hearing, and that was the last we saw.
That was it. Okay.
What was it about?
In terms of the,
His bill.
pretty much along the principles that we've been talking about. I
Right,
believe.
same as, it's a statewide version of H.R. 676, John Conyers' National Single Payer Bill. All of the money that Oregonians currently pay in healthcare premiums, out-of-pocket payments, would go into a single fund, which would then directly pay for everyone's health care. There would be no private health insurance intermediaries.
Do we have that kind of system any other state in the country?
Well, the state of Vermont passed a single-payer health bill, but the implementation of that bill is caught up in the federal waiver system. And Sam, maybe you can explain in more detail the nature of the federal waivers that are needed for both
state.
Vermont and any other state that would pass a healthcare system that differed from what we have
Yes.
now federally.
There are two pieces of federal legislation that makes any state's attempt to create a single payer system within the state more difficult. The first is, unfortunately, the Affordable Care Act, which requires every state to create an insurance exchange of private health insurance companies. And there's no getting around that, not until 2017. So for the next 5 years, 4 years now, states, even if they created a single payer plan, would still have to invest in the health insurance exchanges. Now, our own Senator Ron Wyden is working diligently to create a bill that would allow states to try their own plans without complying with the Affordable Care Act in 2014, as long as whatever they tried provided coverage that was at least as good. But there's not even a waiver that's available yet. The second bit of federal legislation is called ERISA, the Employee Retirement Investment Security Act, 1974. This is the law of unintended consequences. It was trying to do something else, but what it means is that any of these large corporations that have self-funded plans, that have going intact single-payer plans, cannot be absolved of their obligation. They can't stop funding those plans and go to a statewide plan without an act of Congress. Because those plans are governed by federal law, ERISA, and there's no exceptions. There's no waivers available. Vermont, as Steve mentioned, really had to work hard to bob and weave around all of these different federal requirements. And they haven't quite come up with a single-payer plan. For example, all of these self-funded plans are still left intact in Vermont. The VA is left intact.
Of course.
Pretty much everyone else, though, is in a single plan. So if you live in Vermont when this plan is implemented, you will be covered by a single-payer plan, and you will have access to health care, and you will not go broke, and you will not die if you come down with a treatable disease. That's what Oregon is attempting, and that's what about 15 or 20 other states are attempting as well. Oregon's Michael Dembrow is a progressive, far-thinking representative. He's resubmitted this bill in the 2013 session. And we activists are hoping it will not only get a hearing in the House, but it may even reach the floor. And would be really amazing to see the Oregon House of Representatives seriously consider a single-payer plan.
Is there a serious opposition to Dembrow's bill?
It's interesting. There are 3 levels of opposition. There are legislators who believe that it's every man for himself. I made it on my own. If you can't make it on your own, tough luck. Fortunately, there aren't many of them. There are others who believe we have an obligation to take care of everyone in Oregon But we don't believe single payer is at all feasible, even though it's at work and alive all around us. The biggest opposition comes from Democratic leaders in the Oregon legislature.
Democratic leaders.
Because they say, of course we have to take care of one another. Of course single payer is the best plan. But it's not politically feasible, and I'm not going to invest a single bit of energy into making it happen. That's the real opposition.
Why do they think this way and believe this way? Because of the existing system and who really finances their position in government?
We saw what happened to the U.S. Congress attempting to create even a bad health care reform bill. It exhausted all political capital. We're never going to see the federal government, we're never going to see the U.S. Congress even think about another health care bill until every member has retired or died. They're never going back again. It's the third rail. What we need in Oregon are a few more people like Michael Dembrow who say it's the right thing to do, and I'm going to make it happen. And I'm not going to let somebody else give me permission to make it happen. I'm not going to wait for the right time. I'm going to make the right time.
And those kinds of critical social changes never occur unless there's one or two outliers who decide, I don't care. I'm going to push for what's right. I think of the Vietnam War, women's suffrage, civil rights, those kinds of things. And it all started with just one or two radicals like my friend Steve here.
It's going to take more than one or two. I'm not actually really sure what it's going to take. Frankly, at this point in the game, I'm just hoping to see it in my lifetime. We've been given an alternative, actually, in this state, and I suppose before I discuss this, I ought to say that I'm speaking only for myself,
Sure.
and not for any of the organizations that I rattled off earlier. The alternative right now is just for the Oregon Health Plan population in Oregon, which numbers around 600,000 people, and I happen to be one of those people. And the alternative is basically the CCO process, the Coordinated Care Organization process. The process has a triple aim, which it hopes to achieve. The triple aim is better care with better health at lower cost. I can tell you from my own perspective that the concern that I have is that the third part of the triple aim, lower cost, could subvert the first two parts of the triple aim, better care and better health. I don't know whether that will be the case, but I'm in a position where I may be able to influence the process in such a way that we achieve all three. We really won't know whether that's true for a year or two, I would think. And the governor has said that he wants
Governor Kitzhaber?
Yes, Governor Kitzhaber has said he wants to give this process a chance, and several legislators and several candidates for the legislature in the last election said that rather than support the single-payer bill that will be introduced this year, they'd rather give Governor Kitzhaber's health transformation process a chance. The governor has said that he wants to, if this is successful with the Oregon Health Plan, extend the process to the entire population of the state. But he's got to be successful with the Oregon Health Plan population first. And so there's a lot that remains to be seen here. Sam mentioned the basic two aspects of a healthcare system, the financing system and the delivery model system. I've done some research on the delivery model system. It was a system developed by the South Central Foundation and was utilized in Anchorage, Alaska, with a population of about 50,000 Alaskan natives. Several years ago, many people, including physicians from Oregon and people from various Oregon agencies, made a pilgrimage to Anchorage to see what was going on there, including some single-payer docs from Metz Doctors. And
That is how doctor.
and a number of those folks have told me that it works in Anchorage. Now, the population is, of course, much smaller than the Oregon Health Plan population here in Oregon, 50,000 compared to 600,000. But I've also seen the specifics of how the new delivery system model would work if it went into operation. And I think the specifics are good. I saw the outcomes in Anchorage, and they look good. Basically, the coordinated care model at its idealistic best realizes that it has to include almost every segment of an Oregon Health Plan patient's life that affects their health care. And so they're bringing in housing to this, they're bringing in transportation to this. Mental health care will be integrated with physical health care, often on site, something some of us have wanted for many years.
Dreamer.
So that's the idealistic part of it. What I have yet to see are the specifics of how the financing model is actually going to work in practice.
Coordinated care organization, where that come from? Who set that up? Who's in charge of it? Who are the members of it?
You may remember that the Affordable Care Act created...
And where did the Affordable Care Act come from? Obama?
Yes, that's known as Obamacare.
Uh-huh.
The Affordable Care Act, Obamacare, for Medicare patients creates accountable care organizations, in which the accountable care organization gets a flat fee to take care of all of the medical needs of a specific patient.
Mm-hmm.
Governor Kitzhaber here...
Including mental health?
No.
Dental?
No. Governor Kitzhaber here in Oregon said that's not the way to do it. We have to include mental health. We have to include dental health. We have to include public health. So all of the participants of the Medicaid program in Oregon, the Oregon Health Plan, will soon be part of coordinated care organizations, which is sort of affordable care organizations on steroids. It includes all aspects of a patient's life that influences their health.
Sure.
So these coordinated care organizations, which will be taking care of about 15, maybe 20% of Oregon's population, are the delivery systems of the future. They're brilliant concepts with great potential. However, like every other Medicaid program in the United States, it's doomed because of what Steve mentioned. How is it financed? The people who participate in these plans aren't the ones who are paying for it. The people who are paying for all of the Oregon Health Care Plan patients who are getting care in coordinated care organizations are the healthier and wealthier 85% of Oregonians, who are at the same time paying for their own health care. As private health insurance provides less coverage, becomes more expensive, what we're going to see here in Oregon is a drizzle of the formerly healthier and wealthier 85% who get sick, can't hold jobs. They expand the Medicaid population with sicker patients. So the Oregon Health Plan has more and more people who are sicker and sicker, needing more and more money, and the people who are paying for it are smaller and smaller. There's a fundamental flaw that is perpetuated with the concept of Medicaid, which is we separate out the sick people and we take care of them separately. No other country, industrialized country, does this, and no successful healthcare plan has ever segregated out the sick and the poor and said we'll take care of them separately.
So you've talked about the Oregon Health Plan. Can you say a few words about what the Oregon Health Care Plan is so that people have an idea what we're talking about and how it applies to their states?
The Oregon Health Plan is the name of the Medicaid program in Oregon. In California, the equivalent would be Medi-Cal.
Ah, okay.
And may I say a few more words about Medicaid, please?
Please do.
The Affordable Care Act also expands the Medicaid program to an additional 16 million people. And 200,000 of those people will be added to the Oregon Health Plan in 2014, bringing the total population of the OHP up to 800,000. Here, there are a number of flies in the ointment here that I want to mention. The first is that while the feds will pay for the Medicaid expansion for the first few years, after those years elapse, the states have to chip in much larger amounts of money. And we don't know what financial and economic condition the states are going to be in some years from now.
With austerity occurring now.
The economists that I pay attention to, the likes of Paul Krugman and Dean Baker and Robert Kuttner and Joseph Stiglitz, say we're in for a very long, slow recovery, possibly 10 years. Well, the Medicaid money is going to run out long before that the feds are supposed to put into the expansion. Moreover, while the expansion lowers the number of uninsured people from approximately 46 million to 30 million, it still means we're going to have 30 million uninsured folks in this country.
Where are you going to get the money from to pay for their care?
Well, there was that defense sequester, and I would have liked to have seen a tax rate on the rich which was a hell of a lot higher than 39%. And
some people would say he did what he could.
And well, that is a very thorny issue. I will tell you, I don't think so. And not only don't I think so, I agree with Paul Krugman, with Robert Reich, and with Dean Baker, that in putting things like a chain CPI on the table, Obama has set the stage in a very weak negotiating situation, even though he got some of what he wanted, for a debt ceiling debate that will make the fiscal cliff debate look like a tea party, and I use my words advisedly.
Is he being too careful, too conciliatory? Is he being too something? Should he have held his ground for something
yes.
fairer?
Barack Obama is not on Social Security. He is not on Medicare. He is not on Medicaid. He is not on SSI. He is not on SNAP, the program formerly known as food stamps. He does not seem to have a visceral understanding of what life for low-income people is about in this
Some
country.
people would say that he is capable of being sympathetic, but to what extent can he truly be empathetic for ordinary human beings, ordinary citizens?
Well, he's got no Eleanor prodding him to do so. Not that I know of, anyway.
You're telling your age. Eleanor Roosevelt.
Also, he doesn't have a philosophical rationale. Please remember that in January 1944, President Franklin Delano Roosevelt delivered the most left-wing speech of any president in the history of the United States to the United States Congress, and Michael Moore unearthed the film footage for that at the end of Capitalism, a Love Story, showing Roosevelt giving that second Bill of Rights speech, that economic Bill of Rights speech.
Unbelievable.
And I cried watching that, that a U.S. president would be that courageous and that empathetic. Barack Obama has shown few signs of that in his presidency.
He's of a certain class of American that
I agree.
His capacity for empathy is just not what it needs to be socially responsible and to love your fellow human being.
If I could only do a mind transplant and put Cornel West's brain in Barack Obama's head.
You're dangerous. You're utterly dangerous and incredibly beautiful too.
Can we get back to money?
Yeah, we've only got about 4 or 5 more minutes, please.
All right. You asked, where are we going to get the money to provide more health care to more people? If we do it through Medicare, Medicaid, if we do it through private health insurance, the only way to do that is to pay a whole lot more money to bring people in. But if we look around the world, how are they delivering more care to more people for less money? They don't filter their money through private health insurance companies. If we pay without private health insurance companies in the United States, we will save $350 billion a year. That's how much administrative loss there is to passing money through private health insurance companies. That is about $100 billion more than we need to provide health care, complete, comprehensive health care to everyone in the U.S. without discrimination. We're already paying more than we need to provide comprehensive health care to everyone. We're not getting it because we're passing that money through private health insurance. If we have single payer, we recover that money, and without paying more, everyone gets health care.
But Sam, what would you do with all of those people who work in the insurance business? They need to have jobs, don't they?
They certainly do. In 2010, there were 23,000 people in the insurance industry in Oregon. Now, they're not all selling health insurance. There's automobile, life, fire, marine business. Let's suppose that 5,000 of them are put out of work, a fifth of them. Let's double that for the hospital accountants who are out of work. At the same time, national studies, we don't have one in Oregon yet, say there will be at least 35,000 new jobs created in Oregon. That's the new demand for primary care physicians, for nurses, for healthcare workers. There will be an instant demand for 35,000 new people to fill those jobs.
So quickly, Don.
Yes.
Major single-payer rally, February 4th
Yes.
in Salem. We are hoping to get 1,000 people on the Capitol steps as a kickoff event to the introduction of Representative Dembro's bill. Healthcare for All Oregon is one of the major sponsors of the rally. I don't remember HCAO's website offhand.
HCAO.com, 11 a.m., steps of the Capitol, Monday, February 4th.
Is that the opening session?
Yes. Be there or be square. Wear your red shirt. Healthcare is a human right. Let your voice be heard, and make sure legislators know that they can't turn their back on healthcare reform.
You know who the Supremes are here in Oregon? The alternate Supreme Court?
No.
I'm one of those. We've been on TV a number of times. There are 9 judges, citizens who dress up in robes and look like Supreme Court justices, and we march, and
You do synchronized dancing as well?
yes, and people ask questions of the Supreme Court justices, and of course they have me as Clarence Thomas. I don't know why. And we respond to it. It's just
Beard.
delightful, yeah. So we're going to be there. We plan to be on the steps of the Capitol then, and be torn as to whether I'll be wearing a red shirt or my justice robes or not, but we're going to be there too. That's a big deal. It's going to be pretty crowded. I know a number of organizations who will be on the steps of the Capitol in Salem on the 4th.
Healthcare for All Oregon represents over 60 organizations from around the state. It's going to be a busy place.
So, with time running out, what else can we talk about? What message should you give to the viewers about what's happening here tonight and what they should be looking out for?
Debt ceiling debate. No cuts to Social Security, no cuts to Medicare, no cuts to Medicaid. Medicaid is particularly vulnerable here. It does not have the defenders that Medicare does. It's a program for the poor, and programs for the poor never have the kind of defenders that programs for everybody does. It's one of the points that Sam was making about not segregating out populations by class or income.
Yes. Your viewers all have at hand weapons of mass destruction. This simple pen, they should write their legislators, especially here in Oregon, your state legislators, a simple 3-part letter. 1, here's how the healthcare system has failed me, my family, or my business. 2, I want single-payer healthcare bill in this state now. 3, I want you to make it happen. Sincerely, your voting constituent. P.S. If you want to be sure of my vote in the next election, tell me how you're going to make it happen. If every legislator got 10 letters like that in a week, every week, after week, they couldn't turn their back.
What a finishing comment. All right, it's time for us to get ready to say good night because We need another 2 hours. You guys are just too much. Wonderful time. And you're so full of knowledge and passion and feeling about what's so critically important. Yeah.
I'm on Medicare and Medicaid. My rear end is on the line.
That's
And I'm on SSI, which supposedly they're actually not going to cut, but you never know, actually,
never
at this
know.
point.
So let's talk about some public service announcements. To get my show, a local broadcast schedule, go to my website and click on present day activities to see when the show is broadcast. And get my shows on the web, go to my website again and click on favorite links. There's a couple of hundred shows from the past with all sorts of subjects, and go there. And the ACLU, the American Civil Liberties Union, oh my gosh, without the ACLU, our civil liberties would be further down the tubes than they are now with this continuation of the Bush administration under Obama. Next, we want to tell you about having my shows broadcast by other stations in other communities around the country. A public access station, go to pegmedia.org and follow the instructions on how to have my shows imported to your to those local stations. And you got to end corporate personhood. We got to end our show with that one. That's critically important. Corporations are not persons. We have to end corporate personhood. Go to that website, move to amend.org, please. All right. And thanks for watching. And remember KFC, not Kentucky Fried Chicken. Dr. Don's KFC. Kind, friendly, and charitable. Be kind, and be friendly, and be charitable to you too. And you too, especially you. And you too. Thanks again for watching. See you next time. Good night.